Bloated after every meal. Unmasking the culprit you might be overlooking. Health decode. Do you ever experience that feeling of your stomach swelling up like a balloon after you've put down your chopsticks? That heavy, uncomfortable, even breathless sensation that makes you lose interest in all activities? Don't rush to assume it's just because you've overeaten. It's very possible that there are other hidden culprits silently causing post-meal bloating that you're completely unaware of. Join Health Decode as we unveil this secret, explore the surprising reasons behind your unhappy stomach, and discover effective solutions so you can fully enjoy the pleasure of food without worrying about that uncomfortable bloated feeling. Unmasking the masterminds behind the post-meal bloating nightmare. The feeling of fullness after a meal isn't simply a sign that you've loaded too much food into your body. In many cases, even when you eat just a moderate amount, this condition persistently lingers, significantly affecting your comfort and quality of life. To liberate this uncomfortable stomach, we need to unmask the masterminds behind this situation. 1. Wrong eating habits. Unintentional behaviors aiding and abetting bloating. Seemingly minor habits at the dining table can silently aid and abet post-meal bloating. Lightning speed eating and perfunctory chewing. When you eat too quickly, you not only swallow food hastily, but also unintentionally inhale a large amount of air into your digestive tract. This air accumulates in the stomach and intestines, creating a feeling of tightness and discomfort. Additionally, not chewing thoroughly means food isn't broken down properly, putting more pressure on the digestive system, slowing down digestion, and increasing the risk of bloating. Imagine your digestive system as a blender. If you put in a whole apple instead of chopping it, the blender will have to work much harder, and the final result won't be smooth. Similarly, food that isn't chewed properly makes it difficult for the stomach and small intestine to absorb nutrients, while also creating conditions for bacteria in the large intestine to ferment and produce gas. Multitasking meals. Eating while scrolling. Eating while chatting. The habit of eating while engrossed in conversation or glued to your phone or TV screen not only reduces focus on the meal, but also causes you to swallow more air unconsciously. When you're preoccupied with things around you, you'll pay less attention to chewing thoroughly and controlling the amount of food you're putting into your body. Moreover, this distraction can affect the initial secretion of digestive enzymes in the mouth, reducing the efficiency of digestion right from the gateway. The mobile rice cooker. Overloading the stomach. Our stomach has a certain capacity. Regularly stuffing a large amount of food beyond its holding capacity will cause the stomach walls to stretch excessively, leading to feelings of fullness, discomfort, and even breathlessness. The stomach also needs a certain amount of time to digest food. When you continuously load more food before the stomach has finished processing the previous amount, the digestive process will be stalled, leading to stagnation and gas production. 2. Hidden numbers in every bite. Unpleasant foods for the digestive system. What you put into your body directly impacts the reaction of your digestive system. Some foods can become silent troublemakers. Hidden gas bombs. Foods rich in FODMAPs. FODMAPs, fermentable oligosaccharides, disaccharides, monosaccharides and polyols, are a group of short-chain carbohydrates that the small intestine has difficulty absorbing. When these substances move down to the large intestine, they become delicious bait for bacteria. The bacterial fermentation process produces gases such as carbon dioxide, methane, and hydrogen, causing unpleasant symptoms like bloating, distension, abdominal pain, and changes in bowel movements. Foods rich in FODMAPs include oligosaccharides, beans, soybeans, black beans, lentils, garlic, onions, wheat, rye, artichokes, disaccharides, lactose in milk and dairy products like soft cheese, cream, monosaccharides, fructose in honey, high fructose corn syrup, apples, pears, mangoes, cherries, polyols, sorbitol, mannitol, artificial sweeteners often found in sugar-free gum, light products, and some fruits like plums, peaches. The level of sensitivity to FODMAPs varies greatly from person to person. Some people can tolerate small amounts well, while others react strongly, even to very small quantities. Difficult to digest burden. Fatty foods. Fat is an important nutrient, but it takes longer to digest than carbohydrates and protein. When you consume too many fatty foods, the stomach takes longer to empty, causing food to stay longer, leading to feelings of fullness, heaviness, and potentially increasing the risk of acid reflux. These foods include fried foods, fried chicken, French fries, fried spring rolls, fast food, hamburgers, cheesy pizza, greasy stir fries, fatty meats, and processed snacks high in trans fats. Uncomfortable bubbles. Carbonated drinks. Carbonated drinks contain a large amount of dissolved carbon dioxide gas. When you drink them, this gas is quickly released in the stomach, increasing its volume and causing an immediate feeling of tightness and bloating. This excess gas needs to be expelled through belching or flatulence. If there's too much gas, or the expulsion process isn't efficient, you'll feel extremely uncomfortable. Difficult to tolerate strangers. Food intolerance. Food intolerance occurs when your body lacks the necessary enzymes to digest certain components in food. When these components are not completely digested in the small intestine, they move down to the large intestine and become food for bacteria. Bacterial fermentation produces gas and other metabolites, causing a range of unpleasant digestive symptoms, including bloating, distension, abdominal pain, diarrhea, or constipation. The two most common food intolerances are lactose intolerance, due to a lack of the enzyme lactase to digest lactose, found in milk and dairy products. Gluten intolerance, an adverse reaction to gluten, a protein found in wheat, barley, and rye, needs to be distinguished from celiac disease, a more serious autoimmune disease. Symptoms of food intolerance can appear a few hours or even a few days after you consume the troublesome food. 3. The internal battle. Digestive system dysfunction. Sometimes, the feeling of fullness after eating isn't just due to eating habits or the type of food you consume, but can also be a sign of digestive system dysfunction. The chronic agitator, irritable bowel syndrome IBS is a chronic functional digestive disorder that affects the large intestine. Typical symptoms include recurrent abdominal pain, bloating, distension, and changes in bowel habits, diarrhea, constipation, or alternating. The exact cause of IBS is not fully understood, but factors such as abnormal intestinal motility, increased visceral sensitivity, gut microbiota dysregulation, and psychological factors are believed to play a significant role. Feelings of fullness and bloating are often one of the most uncomfortable symptoms for people with IBS, especially after eating. The silent suffering, functional dyspepsia. This is a common condition that causes indigestion symptoms such as abdominal pain or discomfort in the upper abdomen. A feeling of fullness quickly after eating a small amount of food, bloating, belching, and nausea without any identifiable organic cause through tests and examinations. The mechanisms causing functional dyspepsia may be related to delayed gastric emptying, increased sensitivity of the stomach to distension, dysregulation of gastric and small intestinal motility, as well as psychological factors. Abnormal backflow, gastroesophageal reflux disease GERD. Although the typical symptom of GERD is heartburn, the reflux of stomach acid into the esophagus can also cause feelings of fullness, indigestion, and heaviness. Stomach acid can irritate the esophageal lining and slow down the digestive process, leading to discomfort in the upper abdomen. Traffic jam, constipation. When stool becomes impacted in the large intestine, it not only causes discomfort in the lower abdomen, but can also hinder the movement of gas, leading to widespread bloating and distension. Abnormal invasion. Small intestinal bacterial overgrowth, SIBO. SIBO occurs when there is an abnormal increase in the number of bacteria in the small intestine. These bacteria can ferment carbohydrates before they are fully absorbed, producing a large amount of gas, leading to bloating, distension, abdominal pain, and other digestive symptoms. 1. cosadesanta.com. cosadesanta.com. 4. External factors affecting the internal. In addition to factors directly related to eating and the digestive system, several other factors can contribute to post-meal bloating. The mental burden, stress and anxiety. Prolonged stress can affect the normal functioning of the digestive system, slowing down intestinal motility and increasing stomach acid production in some people, leading to feelings of fullness and indigestion. Hormone shifts, hormonal changes, especially in women during their menstrual cycle or menopause. Fluctuations in hormones can affect intestinal motility and cause symptoms like bloating and distension. Unwanted side effects. Some medications, certain medications, such as opioid painkillers, anticholinergics, and some diabetes medications, can slow down intestinal motility and cause the side effect of bloating. Rescuing the uncomfortable stomach. Simple measures you can apply right at home. If you frequently face post-meal bloating, don't worry too much. There are many simple and effective measures you can apply at home to help rescue your uncomfortable stomach. Changing the rules of the game at the dining table. Eat slowly, chew thoroughly, digest easily. Take your time to savor each bite, chewing your food thoroughly until it's almost liquefied before swallowing. This helps reduce the amount of air swallowed and helps the stomach digest food more easily. Temporarily put aside the outside world. Avoid eating while talking, looking at your phone, or watching TV. Focus completely on your meal. Divide the burden. Instead of 3 large main meals, try dividing them into 4 to 5 smaller meals throughout the day. This helps reduce pressure on the stomach. Listen to fullness signals. Stop eating when you feel just satisfied, about 70 to 80% full, instead of eating until you're stuffed. Drink water wisely. Drink water between meals, about 30 minutes before or after eating, instead of drinking a lot during meals. Adjusting the menu. Limit gas bombs. Reduce your consumption of foods that have been identified as causing bloating for you. Reduce the fat load. Prioritize low-fat cooking methods such as boiling, steaming, and grilling. Say no to bubbles. Stay away from carbonated drinks. Understand the strangers. Keep a food diary to identify and limit foods you may be intolerant to. Gentle movement, easy digestion. Taking a light walk for about 15 to 20 minutes after a meal can help stimulate intestinal motility and support smoother digestion. Gentle massage, quick gas relief. Gently massaging your abdomen clockwise can help gas move more easily through the intestines and reduce feelings of bloating. Herbal teas soothe the digestive system. Some herbal teas such as ginger tea, peppermint tea, and chamomile tea can help soothe the digestive system and reduce bloating symptoms. Warmth, relaxed abdomen. Applying a warm water bottle or warm towel to your abdomen can help relax abdominal muscles and reduce discomfort. Red alert, when to seek help from a medical professional. In most cases, post-meal bloating can be significantly improved with simple lifestyle and dietary changes. However, if you experience persistent bloating or it is accompanied by the following serious symptoms, it may be a sign of a more serious underlying health issue, and you should seek advice from a doctor for timely diagnosis and treatment. Severe and prolonged abdominal pain. Unexplained weight loss without changes in diet or activity level. Worrying changes in bowel habits, prolonged diarrhea or constipation, blood in stool. Frequent nausea and vomiting, especially vomiting blood. Difficulty swallowing or a choking sensation when swallowing. Feeling full very quickly after eating a small amount of food. Yellowing of the skin or eyes, jaundice. Swelling in the abdomen, ascites. These symptoms may be signs of serious conditions, such as peptic ulcers, severe irritable bowel syndrome (IBS), inflammatory bowel disease (IBD), bowel obstruction, gastrointestinal cancer, or liver and biliary problems. A thorough examination and accurate diagnosis from a doctor are crucial for appropriate and timely treatment. Don't let post-meal bloating become a constant nightmare in your life. Listen to the signals your body sends, make positive changes in your lifestyle and diet, and don't hesitate to seek help from medical professionals when you feel it's necessary. Follow Health Decode for more useful information on digestive health and tips, so you can fully enjoy life.